for Warringah.
Thank you, Mr Deputy Speaker. I rise to speak on the introduction of the Aged Care Amendment Implementing Care Reform Bill 2022. This is a bill I welcome, following the dire revelations of the Royal Commission into aged care. I would like, though, first to thank the many who work incredibly hard in this sector, and they do their job well. And the revelations of the Royal Commission would have been incredibly distressing for those in the sector that are endeavouring to give that very best of care to loved ones and to our older Australians as they go into that residential care. It's vitally important that this parliament, though, work to improve the standards of our aged care system. The recommendations of the Royal Commission were clear, that much-needed improvements to the way we care for our older loved ones must be implemented as a matter of urgency. So I would urge the Minister to accelerate implementing all the recommendations of the Royal Commission. Locally in Warringah, some 15% of residents are now over the age of 65. As Australia's population continues to age, the systems we currently have in place will need to be ready to cope with increasing demand. We must approach the issue with an unwavering compassion and acknowledgement that there are some systemic flaws in the past that weren't acceptable and that need to be changed. Under-resourcing and lack of preparedness have rendered many aged care facilities ill-equipped to adequately care for their patients and residents. And I think that was made all the harder during COVID, obviously, where additional requirements were imposed and placed upon aged care centres. And we have to remember, they are not hospitals. They don't have the level of care that is available in emergency departments. And so the balance between the resourcing and where the best care can be provided needs to always be front of mind. I've spoken with many local residents, nurses and aged care workers who all believe strongly that having registered nurses on duty will absolutely improve the quality of care and reduce the burden on the health system generally. Registered nurses have the skills and training to treat many more incidents and prevent them from happening in the first place. It will reduce the number of residents being taken to hospital, with care being able to be provided at the facility, reducing strain on our stretched ambulance and hospital services. The Implementing Care Bill clearly seeks to improve the system, and I urge the government to ensure these measures succeed. Costings of the bill are not insignificant. We know this is an issue. An accumulated $460 million over forward estimates, it's substantial. However, it's an investment absolutely worth applying to appease this shocking crisis. And as many have highlighted in this debate so far, it may still not be enough to truly cover the implementation of the measure. The 3 schedules in the bill will improve safety and access to care rights, as outlined in the Australian Charter for Health Care Rights. The implementation of a mandated posting of a registered nurse 24/7 in aged care facilities is a welcome improvement to this access. It's an improvement I've advocated for strongly already during the last parliament, and I spoke in support of the member for Indi's motion in 2021. I've done some extensive consultation with stakeholders and residents in Warringah, and I seek assurance from them that any exemption on their behalf, that any exemption criteria for Schedule 1 will be reasonable and that it would be consistent with the Royal Commission's recommendations. I echo the concerns of the member for Mayo and the Coalition's second reading amendments, with a lack of detail in the primary legislation and the extensive use of delegated legislation. It's critical that the exemption criteria be made known so that we can be assured that reasonable provisions will be in place to protect providers who are unable to obtain a registered nurse. And in that sense, I've listened to the contributions of other members in this place in relation to, obviously, the difficulties in regional and more remote areas. Nevertheless, we also need to ensure that this exemption process is not used by providers to avoid providing better care and having registered nurses. The department estimates that there is a shortfall of some 850 nurses at present to meet the needs of this bill, so we cannot penalise the ratings of these centres for not obtaining staff if it simply doesn't exist. So we need to ensure there are exemptions where reasonable steps have been made to recruit staff, but are prevented by lack of availability amid the skills shortage crisis. Gaps in individual shifts due to sudden illness or injury of staff and difficulties for employers to abruptly source casual staff should also qualify for a reasonable exemption. The onus should be on the federal government to appease the skills shortage we're facing and help ensure these exemptions are minimised. The bill also seeks to cap home care costs, specifically pertaining to service providers no longer charging for a cessation of care. I support this in principle, as we need to target and prevent unreasonable outlier prices in home care. Some stakeholders in my electorate hold concerns that this schedule would grant the government an unlimited power to regulate all home care prices. So I do call on the government to be always transparent and consultative if they are to implement discretionary regulatory powers. There are some issues still relating to the crossover between aged care and NDIS, and it's not pertaining to this bill, but it is an issue that I would urge the government to address, is the gap and the age discrimination that exists in the NDIS system as people then transfer to the aged care system. Public disclosure. The third schedule seeks to mandate public disclosure pertaining to aged care services. And I support this in principle because we need transparency. But I find it to be broadly written, and a general power to disclose information without parliamentary scrutiny could be problematic. So I trust the government will consider reasonable privacy with regards to important information if it's published. When the Royal Commission was released last year, Australians were collectively horrified to learn of the extent of the real human tragedy in the deeply fractured system. The malpractice and under-resourcing were a clear violation of the right to access adequate health care, and I'm pleased to see this bill introduced so early in the government's parliamentary agenda. The bill will aim to rectify these three serious gaps in the aged care industry that were outlined in the Royal Commission. So these are important to fix, but we must remember the Commission produced 140 recommendations to fix this system. So we must ensure progress is continual. There is significant pressure to reform the sector ahead of the impending jump in demand. To remain ill-prepared for this will be catastrophic. We can't allow this sector to under-deliver quality care. In consultation with the aged care workers in my community in Warringah, further fractures have been identified. One aged care worker I met with identified that there's a significant gap between some aged care participants receiving access to great support and others who are not. One aged care worker has alerted me to instances whereby she witnessed dangerously poor hygiene in facilities and at home, long wait times for support and assistance, and even if an emergency button had been pressed. She identified that, alarmingly, she's seen staff administering medication to control behaviour and believes that it may have been unethical and unnecessary sedation. We know these are the types of issues that were raised during the Royal Commission. Reporting these serious issues to the appropriate channels can prove challenging for some aged care workers. And I note that these complaints are not always acknowledged. So we need to ensure enough streamlined reporting systems are in place so that quality care can be monitored and applied consistently across Australia. In my community, there are concerns also that some providers have too many people on their books, and so they're not resourced enough to provide substantial care for all of them, with fears of a profit over people mentality still exists within the sector following the revelations of the Royal Commission. In particular, the concern is for older people without family or close relations, or if they're under public guardianship. They're often left behind with inadequate support. The disparity in quality of care needs to be addressed in those circumstances. It has to be acknowledged, instigating and navigating the aged care system can be a daunting thing to do for families and for older Australians. The sector can be quite complex, and many older people rely on family and friends to help guide them through the processes of application, assessment and engagement with service providers. Sadly, people who struggle to instigate or navigate the system find themselves being left behind. So as we age, our circumstances can change rapidly, and this heightens my concern that underinvestment in my aged care has seen waiting lists explode. It can take upwards of 12 months on a waiting list to access home care packages. In that time, one injury, a fall or a sudden cognitive decline can see an older Australian completely without access to the level of care they need to stay in their homes. So I do urge the government to eliminate the home care wait list as per the Royal Commission recommendations and reform the system to make sure it is sustainable and fit for the ageing population we're dealing with. Keeping people in their own home longer should be a core goal of the aged care sector. And this is again where we do see the age discrimination between the interaction of the NDIS scheme that finishes at 65 and then the aged care, which does not provide the same level of support. Again, for those without family or community assistance, they find themselves dangerously under-supported as their needs grow. Without ease of access to adequate supports, older people may be forced into aged care facilities. This is not a benefit to the government or the economy or the community. For those who live in residential aged care facilities, care needs to be equitable and consistent. The best way to ensure this is to ensure we have well-trained, well-resourced staff. There are profound opportunities to stimulate the economic benefits of a well-functioning aged care sector. We know this is where the megatrends and the employment opportunities are. We know this is where the skill shortages are. The reforms recommended by the Royal Commission could create around 30,000 additional full-time jobs in aged care by 2030. This excludes the additional 50,000 extra full-time workers that will be needed because of population trends. So now is the time to capitalise on the opportunities afforded by reforming the sector. But of course, we also need to make sure they are properly valued. You cannot expect people to work in these sectors, which we know are so incredibly essential to our ongoing standards that we expect in our community, without them being properly remunerated and valued in our society. So this bill brings forward good measures to address three key gaps that were revealed by the Royal Commission into aged care. It's vital the implementation of these schedules is done so thoughtfully and carefully, and meaningful changes can succeed. I wish to thank those who work hard. They work so hard to provide quality care within this sector. Their contributions are vital to our older Australians in our communities. It's time we ensure that the unacceptable standards of the past are amended, and I look forward to continued action from the government and the minister and seeing this happen. Thank you.